Our third and final speaker today is Rachel Lavin. Rachel is the Health and Wellbeing Research Assistant at the Applied Health and Wellbeing Partnership, and she's been with the team for just over a year now. Rachel's got a background in psychology and has experience in mental health practice and counselling. And over the past year, Rachel's worked on a number of projects, including an evaluation of the Wirral project, which is a young person's counselling service for young people affected by alcohol misuse, and also supported insight work that we've done into attacks on sugary drinks across the Northwest. And Rachel's going to talk about her involvement in one of the evaluations that we did earlier this year around admissions prevention and facilitated discharge.
Thanks, Hannah. Hello everyone, my name's Rachel and I'm going to be speaking today almost from a researcher perspective and speaking about a recent evaluation that we did kind of at the beginning of this year on an admissions prevention and facilitated discharge service in Wirral. Now it's quite a mouthful, that service, so I'll just call it the APFD service from now on. So I'll just give you a quick overview of what I'm going to be speaking of today. I'm going to give some research and some rationale behind the service so you can kind of get a general idea of why it was developed. I'll speak about the service itself and who runs it and what it aims to do. I'll then speak about the evaluation that we did, and I'm going to go over the results as well, and then also give you kind of a brief summary of those results. And then I'm going to speak about the impact and what happened as a result of our evaluation. So just to give you some research and rationale for the service, older people are the main adult users of NHS services. They typically occupy about 2/3 of inpatient hospital beds, and as you can see here, 80% plus of emergency admissions who stay for more than 2 weeks are actually patients who are aged over 65. And this is something that's very topical at the moment, especially with NHS budget restraints. It's something that's in the news a lot, of hospitals struggling to meet patients' needs, and just a general kind of pressure on hospitals in general. So it's also worth noting here as well that Wirral, because the service is based in Wirral, has quite a high proportion of older adults compared to other areas within the UK. But it's not all doom and gloom, because areas in the UK that do have well-developed integrated services for older people do tend to have lower rates of hospital bed use and also lower readmission rates as well. So there is something that can be done. And what research has found is that rapid access community-based care services for elderly patients can actually improve patient satisfaction, they can improve outcomes, they can also reduce demand on acute services like hospitals, and they've also been found to be a more cost-efficient method of care. So just to kind of give you a brief snapshot of the service overall, it's a community-based service and they typically work with older patients. And what they do is they provide increased packages of care, so this can be within an individual's home. They provide access to therapies, so physiotherapy and adaptations within the home as well. They also arrange rapid access, respite and 24-hour care nursing beds as well, so that's an alternative to a hospital stay. And if an individual is deemed to need a hospital admission, which can happen if their needs can't be met, if they're not safe within these environments, then if they are admitted to hospital, they will then try and facilitate an earlier supported discharge as well to get them back and being independent within the community. And also they do arrange long-term care placements when patients' care needs can't actually be met any longer within the community or within their home. And all this aims to prevent hospital admissions and also facilitate a quicker discharge, a supported discharge, if individuals are actually admitted into hospital. So the team itself is led by a senior nurse clinician who's experienced in caring for elderly patients, and she has a team that includes healthcare assistants, some nurse practitioners and also admin support staff. And the team itself works very closely with health and social care multidisciplinary teams to support case management approaches to patient care. So within year one, they had 334 referrals, and as you can see, the most common causes for referral were for fall or COPD and dementia, and typically, again, as I say, it was older patients. So now just to speak about the evaluation that we did, Before we did the evaluation, there was a review done by the clinical commissioning group who commissioned the service that identified that respite packages, home care placements, and also access to therapies and equipment, they estimated had prevented hospital admissions in over 45% of referrals. So they had an idea that the service was working on the ground, it was preventing hospital admissions, but the commissioner wanted an exploration of how exactly the service was impacting on the patient if they were having a positive experience. And they also wanted to present these findings at a commissioner's board meeting as well, to see if the service could be improved or recommissioned, and to highlight it basically there at that meeting. So what we did was we did a qualitative evaluation to explore the perceived impact of the service upon the patient journey, and the evaluation design and the participants and the topics for interview discussions were developed in liaison with the commissioning support managers, so they were very involved, and also one of the service providers as well was very involved. So we did semi-structured interviews and we selected healthcare professionals, and these were healthcare professionals who were involved in delivering the service, or they were involved in referring into the service, or for some it was those who were involved in providing a service underneath the APFD, so like community-based services like physiotherapy, they would work in with the APFD service. So there was kind of a range of different healthcare professionals we worked with there. And we also spoke to family members of patients, and we actually went out to their houses and spoke to them within their homes and asked them about their experience of the service and the patient's experience of the service. And through that we got 5 patient journeys elicited. Now, patients themselves weren't actually included because due to the nature of the service, they might have been too unwell, they might have lacked capacity to consent, or they might have recently passed away. And this was kind of reflected when we were speaking to family members. Three of the patients were in later stages of dementia. 1 patient had recently passed away, and another patient had made a full recovery and was at home, but then if we'd only selected patients that were well enough to take part, it would have resulted in a biased view. So we decided to focus upon family members and family members of patients who had had different journeys. So as you can see from that, they all had different journeys, and it was really to try and not cherry pick family members. We wanted a range to kind of give a good reflection of the service overall. So what we did with the interviews is we transcribed them and then we analysed them thematically by the evaluation team that was analysed. So just to go over some of the results from the healthcare professionals' perspective, it was quite clear that, especially from GPs' perspectives, that they face a lot of difficulty when trying to care for elderly patients. And some of the quotes illustrate this as well. One that says, "Sometimes you feel like you've got to jump through so many hoops to get a response." Another one said, "The default position historically had been a hospital admission because as a GP you didn't really have any other option, and other services tended to not be able to respond quickly enough." And this was also reflected in the responses from the people who deliver the service. They felt that they were delivering a unique service that was almost able to address some of the difficulties that they felt were prominent. So when we asked them about their experience of the service, they gave glowing reviews of the service. GPs said that they felt it was probably one of the best services that has been developed. They felt that it was a really good service, that they wouldn't want to lose it themselves. And also people who were involved in delivering the service, so working within the service themselves, felt that they had a lot of job satisfaction from what they were doing, but due to increased demand, they felt that they could do with more staff. So they were saying, we're enjoying our job, but we're getting so many more referrals now, so we could really do with more staff. So this was included in our evaluation and highlighted as well. So when they spoke of the impact of the service, there was this view that the service was actually empowering people at home, so it was allowing people to maintain their independence without having to go into hospital. It was found that it was offering support to families, so the service was found to really work closely with family members and patients as well, and work with them basically and better support families overall, that it was felt. And also they felt that it gave them, again, choice, because before the patient really only has a choice to go into hospital, this offers an alternative way of supporting the patient's needs. And all healthcare professionals also agreed that they felt that it had definitely prevented hospital admissions for the people who'd used it. Now, facilitated discharge, a couple of the GPs did mention that they felt that it had, but other people had had less experience of the service facilitating a supported discharge from hospital. And again, this was made reference to within the report. And the successful attributes of the service from the healthcare professionals' perspective was the fact that it was a rapid response service, so they were responding to needs quickly and they were preventing a crisis from happening. So this is illustrated within that quote. They're providing almost a rapid response service to people who are either becoming unwell or beginning to have a crisis, and that was seen to almost solve the problem and the difficulties that healthcare professionals felt, especially GPs, were prominent in trying to coordinate care around an elderly patient. It was seen to almost fill that gap. They also viewed the service as a specialist service, so it was a service run by people who were experienced in coordinating care for the elderly. GPs felt that they were better supported because they could liaise with the service and they could rely on the service's expertise to be able to better support their own patients. And again, there was this view that it provided this kind of integrated, personalised care. So it listened to family members' views, it listened to also the patient's views, what they wanted. Did they want to go into respite? Did they want to go into hospital? Did they want to be at home? And then they would try and personalise a care plan around that as well. So it was very much found that it was for that person. It was personalised to their needs. So now to just talk about the results from the family members' perspective. Again, this kind of echoes some difficulties perhaps in caring for elderly patients. They felt that the patient that they were caring for, because a lot of these family members were caring for this patient at home, within their home environment, trying to meet their care needs. They felt that this quote kind of illustrates it quite well. Patient was falling through cracks. That's why patient got so damaged, because there was no one on patient's case. When I tried to get the name of someone on patient's case, I couldn't. And they all spoke of being very, very frightened and very helpless because their family member, who was usually older or maybe a parent in that kind of role within their family, became increasingly unwell and they didn't know what to do. So they said that they were very frightened. So we then asked them what happened when the service did intervene, and they said that the service had transformed the situation. They had really positively changed the situation. These quotes say, service provider intervened and made it all happen. Everything kicked into place straight away. So the fact that the service had intervened at that point seemed to provide quite a high impact service. The fact that they'd experienced so much difficulty beforehand, and when the service did come in, they almost seemed to transform the situation for them. So family members also spoke of the impact on the patient. So they felt that the service had come in and taken the patient out of danger. Another quote says that service provider made all the necessary phone calls to get patient into a safe place and all the levels of care that they needed at that time to prevent them from becoming worse. And they all said that they felt that it had prevented a hospital admission. And some again also spoke of facilitating discharge if they were admitted into hospital. But again, there was this emphasis on the successful side of the admissions prevention of the service. So, and again, it may be worth highlighting as well, some family members also spoke that they described how they felt that the service had actually prevented their family member, the patient, from actually dying because things were getting so dire at home. So when they spoke about the impact of the service upon them as family members and carers for this elderly patient, they said that the impact was remarkable, that the admissions prevention was a lifeline for them, that they were very, very relieved. And they were glowing in their appraisal of the service. They said, that whole service, I can't praise it enough, I really can't, the help they gave me and patients. And again, they said they were absolutely fantastic. I couldn't have asked for more, really. So they were very, very positive in their appraisal of the service. And the successful attributes of the service from their perspective were that the service gave them support and also would communicate often with them. So family members would speak of how the service provider within the service gave us her office number and her mobile number and answered and was on the case, and then she remained in the picture. And they almost gave this picture that the support and that regular communication had really helped them through that period, that almost transition within their family when that patient had become unwell. They also spoke about the quality of the service providers, so the fact that the service providers were experienced in caring for the elderly. They said that they felt that they were in expert hands, that they knew how to coordinate care for an elderly person. And again, another key theme that came from that was responsibility, so the fact that somebody was able to take responsibility for that patient. So that's illustrated within this quote, saying, service provider understood that it was a process that had several stages, and she was willing and able to be responsible for that whole sequence. And they were really the successful attributes from their point of view. So then what we did, with all these findings all together, we then triangulated them all, and this resulted in these I think I've got 4 there, but I think there's actually 5. And the first one was the fact that there are difficulties faced by both healthcare professionals and carers and family members. So there's some sort of difficulty going on there. The fact that the service itself was quite accessible, it was rapid in its response, so therefore it was kind of filling that gap that perhaps services weren't able to respond quick enough initially, but with this service it was plugging that gap almost and preventing a crisis from happening. So they also spoke about the fact that it was personalised care, and this was a theme throughout, saying that it was very much based on that individual's needs, and they would try and accommodate that individual's needs as well. And also this view that the service was a specialist service, so it was run by people who were experienced in the care of the elderly, and people felt almost better looked after, both the patient, the family members and the healthcare professionals as well. And again, they emphasised the impact of the intervention on patient outcomes, so they gave examples when the service had intervened and it had resulted in a more positive outcome, or they'd intervened and tried to make a better outcome basically for the patient. So just to now talk about the impact of this evaluation. So this report was presented and published, and then the findings were presented at the Commissioners' Board meeting, who was able to say, here's this evaluation, here's the key things that have come out of it. And then from that, the service then got recommissioned for another year. And this is something that's taken from the Wirral GP-CCG statement, was the fact that the service does have a reduction in number of admissions due to the service, and also very good practice and carer feedback from this evaluation. And the fact that the service is cost efficient as well, so you have an early indication of return on investment from the service as well. And the strategy then that they have put forward for the service is to develop the service to also focus upon the facilitated discharge aspect as well, because there's this real emphasis on admissions prevention. It's very, very successful at that, and that was something that was found within our report. However, people had less experience of this facilitated discharge, the service intervening and facilitating a more supported discharge. So they're going to develop the service there, and they've also, in conjunction with that, they want to increase the capacity and working hours of the service so they can be able to provide the facilitated discharge service. And that also comes from the evaluation highlighting that staff were saying that it was getting quite busy now, so they could do with more staff because the demand was going up. And then they said that they're going to use the service to use it as a vehicle to build upon collaboration with local authority and secondary care as well. And overall, this evaluation and findings from other research, particularly within Wirral, forms part of a larger multi-agency integration programme which is being rolled out, and this is kind of where the wider impact of these findings comes in. And this itself is aiming to integrate all health and social care services within Wirral by 2018. And from what I've read from their strategy, it includes the development of 8 integrated care coordination teams, similar to the admissions prevention, to have one community gateway as well for patients to come through within the community, and also one hospital gateway as well, so that would kind of, I guess, be more the facilitated discharge service as well. So thank you very much for listening.